In today's video, I'll be providing you with key tips on how you can ace the AKT or Applied Knowledge Test. Hi everyone and welcome back to my channel. If you're new, then a massive welcome to you. My name is Dr. Baptiste. I work as a portfolio GP. If you are new and you haven't subscribed, then why not consider subscribing, because I have loads of useful videos to support you on your medical career journey. As always, make sure you give the video a thumbs up if you enjoyed it. In the first part of the video, I'll be going through the format and structure of the exam, key dates and the booking periods, what's actually tested in the exam, and the feedback report from previous sittings and why it's so important to go through the reports. In the second part of the video, I'll be talking you through my own personal experience when I sat the exam and 5 key tips on how you can pass this exam comfortably. Okay, so let's go through the format and structure of the exam. Before you tackle any exam, you need to know exactly how the exam is structured so you can prepare to the best of your ability. So the AKT or Applied Knowledge Test is a computer-based exam, and it is the first exam that you take before you're able to take the practical exam, or CSA as it was previously called before the pandemic. This exam will test your knowledge base for independent practice as a GP here in the UK. The exam focuses more on problem solving rather than basic recall of facts. The AKT takes place 3 times a year in Pearson VUE centres across the UK. According to the MRCGP, there may be reduced availability because of the pandemic. So the next exam, at the time that this video goes live, would be the 28th of April 2021. The exam is a pretty long one. It's 3 hours and 10 minutes, and during this time you'll need to answer 200 questions. The majority of the exam is clinical, so 80% of the questions you'll need to answer are clinically based, and the remainder will be a combination of evidence-based practice, which is 10%, and the remaining 10% will be on primary care organisation. So what is tested? Well, I'm actually going to show you now the GP curriculum, or part of it, and this will form the basis of what is tested in the exam. Like I said at the start of the video, it's really important to look at the feedback reports from previous sittings. If you do look at the report, which I would strongly advise, the report goes through what areas candidates performed well in and what areas that candidates didn't perform so well in. So it would be good to know about these areas and then tailor your revision to these particular areas. So in terms of my personal experience, I passed the exam the first time. I booked the exam during very busy rotations, but I gave myself about 6 months during which I could prepare and plan adequately. I did use one question bank, which I'm not going to mention here for a number of reasons, but it really depends on your own preference and your learning style and what works for you. So I used one question bank that worked for me, and it was actually recommended by some of my peers from previous years. So it may be worthwhile speaking to those in your cohorts, in the years above you, people who have done the exam before, to see what they recommend. But of course, it will come down to you and what you feel comfortable working with. So I used one question bank. I didn't really use any books and I didn't really take any notes. I didn't think writing notes would be beneficial to me. I also took 5 days annual leave and 5 days study leave, which at the time the trust would allow you to have 5 days study leave for an exam. It may vary depending on where you're working, so it's worth obviously finding out if you're allowed to take 5 days or a number of days of study leave for an exam. So despite doing many questions over many months and preparing early and then doing a few mock tests in the lead up to the exam, like in the final couple of weeks, I still found the exam was quite tight in terms of time. I finished the exam with probably about 15 minutes to spare, if I remember correctly, and I did go back through a number of questions, but I never change my answers. I always go with my gut instinct. My first answer is usually correct from previous experiences. So I remember going through the exam, going through some of the questions, but even if I doubted myself, I wouldn't change it. I would just leave it alone. That would be my advice to you as well. Try not to change your answers. Like I said, with my previous experience, usually your first answer is, or my first answers were correct. So I'd probably advise you the same. Try and just stick to the first answer. I do talk a bit more about study methods in a previous video, which you may want to check out. So now I'm going to take you through 5 key tips that are going to help you ace this exam. Tip number 1. Before you take any exam, and of course in particular this one, have confidence in yourself. You don't want to fail the exam before you've even started. It can be very easy to be intimidated by the exam, to think there's a lot of information, and there is. To be a GP, you have to know quite a lot of information, and it's quite broad subject areas. So yes, there is a lot to remember, but don't be intimidated. It can be done, and you've made it this far, so there's no reason as to why you can't pass this exam. So you need to get into the mindset before you even think about tackling this exam. So I passed the exam first time, and like I said, it is in the mindset. However, I didn't pass the practical exam the first time for a number of reasons, which I talk about in a previous video, where I actually discuss how you can overcome failure. If you want to know how to prevent failure and how to overcome failure if you do happen to fail, then make sure you watch the video. Tip number 2, preparation is key. So I would always advise you to start revising early for any exam. Again, it may depend on the type of person you are. Some people like to be under pressure and take only a couple of months for the exam or weeks. I personally wouldn't do that, and I wouldn't advise you to do that. So I sat the exam in my second year. I would recommend sitting it in the second year versus sitting both the practical and written exam in your third year. There's a lot to do in the third year, and so for me, I felt that it was better to take a bit of pressure off of my shoulders and sit the written exam in the second year, which would enable me to focus much more on the practical exam and all the other things I had to do in my final year. Tip number 3, make sure you know how to revise. It's very easy to sit there and just do questions and to just write notes, but make sure you have some specific study methods that will help you. Tip number 4, resources, or choose the right resources for you. Like I said earlier, I'm not going to recommend any particular resources. You may find that a combination of resources like books, question banks, and courses work for you. I personally didn't book any courses. I felt that I didn't need to, but you may feel different. Like I said, I used one question bank, and I think there must have been over 1,000 questions, which I did twice. And I also did some mock timed tests towards the end of my revision period, just before the exam. I can't emphasize enough that the key here is answering as many questions as possible. You want to be able to problem solve, and you want to pick up patterns. A lot of medicine is about pattern recognition. So the only way you can do that in a short space of time, efficiently and doing it really well, is by answering loads and loads of questions and just picking up those patterns. Again, a key tip here is to know the guidelines. I would say from day 1 of your GP training, and probably before actually, but in particular for your GP training, know the guidelines. Use the guidelines as a very, very good tool with every consultation, or the majority of consultations that you have every single day. When I talk about guidelines, there are a number of different guidelines. The most common and most widely used in the profession would be the NICE guidelines. This is the guidelines that we use the majority of the time anyway as GPs, but there are other guidelines as well, like BTS guidelines, SIGN guidelines. So have a look around, make sure you know the guidelines. People often find that the NICE guidelines are quite a lot to digest and take in. So what I would say with that is that there are NICE CKS, there are shorter guidelines that basically summarize the bigger documents, which can help you every single day with every single consultation. So it would be much easier for you, not just for this exam, but for the practical exam, if you know the guidelines. It's difficult to say off by heart, but to at least have a good understanding of them, and you probably will end up knowing them off by heart if you keep using them every day. So like I said, make sure you know the guidelines as well. There are various guidelines, but the main ones I'm referring to would be the NICE guidelines. Tip number 5, prepare for the actual day. Now, like I keep saying, everyone is different, but I'm going to give you a few things that work for me and that help me pass the exam first time. So nearer to the exam, you'll be sent some information by the MRCGP, and I would recommend that you read this information very carefully. When I sat the exam, there were some practice questions on the website, so have a look at those. They do give you a good idea of some of the types of questions that you'll be asked. Know how to get there. It may seem quite obvious, but in a previous video where I talk about the MRCGP exam, I thought I knew where the centre was because I'd been there before for a driving test, and actually it had moved not very far, and so when I got there I had to find out where this new centre had moved to, and luckily it wasn't very far. But know how to get there. Decide on the form of transport that you're going to take. Are you going to drive? If you are, is there parking? Do you have to pay for parking? In most cases you probably do. If you're going to take a bus or a train, just make sure you know which ones you're going to take, and a backup. Always plan alternative routes because you never know what could happen. Also, make sure you know which documents to bring to the exam. This is very, very crucial. You don't want to be denied your chance at sitting the exam because you've forgotten one crucial document. So make sure you know exactly what to bring. And I personally pack the night before, so that might work for you. Or you might find the morning of the exam or the time before the exam, if it's an afternoon sitting, is the best time for you. But just make sure you know exactly what to bring and that you have those documents. I would always recommend resting as much as you can the day before, the morning before. If you have an afternoon exam, try and rest as much as you can. I know it's easier said than done. I probably didn't rest as much as I should have, but that's why I'm telling you to rest. You want to try and clear your mind before the exam. So take some time out before the exam. If it's a morning exam, take the evening off if you can. Try not to think of the exam. Try not to learn anything new in those few hours or days before the exam. What you want to do is repeat and consolidate your knowledge. It is not the time to be learning new things. And like I said earlier, although I practiced loads and loads of questions and I did time tests, the exam was still quite tight. It will be. It's nerves, it's a number of things on the day. I still finished the exam, I think about 15 minutes to spare. But make sure you keep an eye on the clock and stay calm. That is really the most important thing I can tell you. Stay calm, because when you panic, you can't think. So stay calm, take some deep breaths, and I know you will do well. So those are some of the key tips that I can provide you with to enable you to pass the exam. I know you're going to do well. If you are struggling, then seek support from your peers, from your supervisors, and I'm always here to provide support to you where I can. So leave me a comment in the comment section below if you think I can be of help to you. And as always, if you haven't subscribed, then make sure you hit that subscribe button and give the video a thumbs up if you found it useful. I will see you in my next video.